Hello, everyone. I am Dr. Mapouka. I am from the Central African Republic. I am in my second year of Master of Public Health with a concentration in applied epidemiology at the Gilling School of Public Health, UNC-Chapel Hill. Today, first of all, I want to thank you so much for being here today. So for this presentation, I'm going to talk about the community solution to improve health outcomes in the Central African Republic. But before I give my presentation, I wanted to ask you this question. The Central African Republic is DRC Congo. How many of you will say it's true? Please raise your hand. That's a very good score. Thanks so much. Well, I really hope that you say it is false. Does anyone want to know why I asked this question? Thank you. Since I've been living in the United States for 2 years now with my fellowship, every time people ask me, where are you from? I say, well, I'm from Central African Republic. And there's always a second question that comes after that. Is that Congo? And I said, no, that's not Congo. It's different. So here, I give you a map of Africa. The Central African Republic is right here in the middle. Like you can see, the green color, right? And Congo, DRC Congo is just at the bottom. There's another peace fellow from Congo, by the way. Thank you, Alex. So, if you live in the United States, you want to ask yourself, how can I compare Central African Republic in terms of size to United States? There's a good answer for that because Texas has almost the same size as Central African Republic, which is at least 600,000 kilometers square. For this presentation, I'm going to talk a little bit about Central African Republic background. Then I will give you the most common diseases we found in the country. And I will talk about the genesis of Ikeoko. Then I will touch base a little bit on the approach of disease prevention that Ikeoko is doing in the field before I talk about challenges and opportunity and how all of we here can also involve. So the Central African Republic is a French former colony. We got our independence in 1960. The country has at least 4 million population. We have at least 72 languages. It's a very multicultural and diverse country with a very great hospitality. Unfortunately, as you can imagine, in certain countries in Africa, we have many challenges, such as army groups proliferation, we have gun injury, refugee crisis, and of course, the recent COVID-19 pandemic that also affect the country. So my first disease burden that I want to talk about here concerns the most vulnerable population, the under 5 mortality rate, which affect our children. So if you look at here, in the middle, you see that the Central African Republic has a high rate of under 5 mortality rate compared to the Central and Western Africa as well as the United States. Is much more better with the United States, right? 6.3. Second thing, if we talk about Africa country, we need to talk about malaria. So this graph right here shows us how the incidence of malaria during the past 5 years has been very high in blue compared to Western and Central African Republic. And by the way, there is something very interesting, like I pointed right here. If you see that, you ask yourself, why there was a peak in 2019? Well, I believe that was caused by the political instability, the conflicts that we experienced in the past. The next thing I want to talk about is how women are affected in terms of maternal mortality rate. So this graph shows us that Central African Republic has a higher mortality rate compared to the Central and Western Africa, as well as the United States. And the last thing I want to talk about, well, we cannot only continue to talk about bad things. There's a good news about HIV. There is a decreasing of HIV incidence during the past 5 years or 6 years. Like you can see, and the last data we have from 2019 show the incidence of HIV 1.2 compared to the Central African and Western African region, and the United States, which is 0.2, much more better, much more constant. Now, I just talked about most common diseases we have in the field, but there are so many other problems. What more can we do to improve the condition of health in the Central African Republic? I think, personally, we need to adopt a local-driven health solution to improve the health outcome in the Central African Republic. So before I talk about the next slide, there was a question here asking, what individually can you do in the field as a peace fellow? So I'm very happy to talk to you today about Ike-Oko. If you ask yourself, what does it mean, Ike-Oko? Well, Ike-Oko is an idea of unity, we are together, which is perfectly a good example to bring people together after a series of conflict through health intervention. Ike-Oko means in Sango that I just explained, we are together. Where does this idea come from? Well, it's just my personal story. I was born in the city, which is Bosambele. After I graduate, I work with international organization, Médecins Sans Frontières, ICRC. I work as a rural physician. This is me right here with my colleagues. Performing different tasks, surgery, treating patients with malaria, HIV infection, so many things. And then I became very aware that the importance of having an integrated approach which is adapted to the local context in Central African Republic. Like I said, it was developed by me. I was raised and lived there. I better understand the situation. I work and practice medicine in the rural area. And all of that contribute to build a trust in the communities that I belong to. They trust me than any international organization. And I think the idea of Ike-Oko is most effective in terms of resources, public health intervention. But there's also an idea about the sustainability of the program that we have. I give you here some of the resources that we use in the field to try to work on the disease prevention, and especially for malaria, we distribute a lot of mosquito nets to family, household, and we provide also some trainings. We have also a program on gender-based violence prevention. And so far, we were able to implement center intervention in terms of data that I put here, 12 health sessions for training. Also, we're able to provide some mosquito nets to deliver some prevention program in the community in Bosambele. But of course, we we plan to evaluate what we did in the field with my colleagues in terms of improving knowledge to disease prevention, but also to reduce the incidence of diseases that I talked about. What are some of the challenges that IKIOCO face? Well, as any organization, the big problem is just funding, right? So we operate so far in a very volunteer basis. We were able to collect some funding locally, but we hope that in the future, that's an opportunity for everyone to participate. And we believe that having a local organization, any public health organization, developed and implemented by someone from the field, from the province in Central African Republic, is a good idea to reduce disparity, health disparity. I put here one story about my colleagues, a physician working in the field, who is providing training to the local community healthcare workers in terms of making sure that the vaccination statute is respected in the community, especially for polio vaccine, giving those training to those communities. Then I can go to giving those training to these community healthcare workers can allow them to go to the communities and deliver the message that we have. So thank you so much for listening. I want to say Singila in Sango, which means thank you. Also, merci in French. And if you have any question, please feel free to reach out to me. Thank you so much.